Okay, so I'm gonna just do a quick check of my surroundings. Here's Joe, computer stand, and there's nothing over here. Here's my stuff here. It's blank. This is my drug card because I forgot mine at home, so I did do quick supplies. Joe, the table. Okay. I will be moving my computer like a little bit back and forth on this table so that you can see me do my stuff over here. So first, I'm just gonna do my entry and everything. Okay. Hi Joe, my name is Danielle. I'm going to be your student nurse today. I'm going to perform hand hygiene and provide privacy. So I'm going to verify your name and date of birth with my provider's orders. And I have the right client, which is Joe Smith, with the birth date 10/5/1954. And his allergies are sulfa and betadine. So Joe, I hear you've been having some pain. Joe says that his pain is an 8 out of 10 and it is like a throbbing in his legs. So Joe, I'm going to give you a PRN medication of Toradol. I'm going to give you a PRN medication of Toradol and for your pain. Is that okay? Okay, so it is an intramuscular injection in your thigh or in your hip area here. Is that okay? Joe says it's okay. So I'm going to be doing an intramuscular injection in the vasogluteal. So how I would do that, I'm just going to demonstrate the anatomical landmark. So I'd place my palm on his acromion and my pointed finger on the iliac spine and my middle finger on the iliac crest and my thumb pointing towards the front of Joe's body. I will give my shot right here. If I was giving it into the deltoid, I would line my pointed finger with the acromion process and thumb pointing down to his feet. If I was giving it into his vastus lateralis muscle in his leg, I would place my hand on his leg and have my fingers lined up with the greater trochanter and my thumb pointing down. So I've provided privacy and okay. So I'm just going to move my computer. If I was doing a subcutaneous injection, I would do that 2 inches away from the belly button. If I was doing a intradermal injection, I would do it in the antebrachial area of the arm. So okay, so first I'm going to verify provider's orders I'm going to verify my MAR with provider's orders. So I have Joe Smith with Toradol or Ketorolac, 30 milligrams IM as needed every 6 hours for moderate to severe pain. And on here I have Ketorolac or Toradol, 30 milligrams IM every 6 hours as needed for pain, and it has not been given yet. And Joe's in pain, so we're gonna give him some pain medication. I have the right time, it has not been given yet, the right dose, which is 30 milligrams, the right route, which is IM, and the right medication, which is Toradol, and Joe Smith, like I said. So I'm going to get my medication out of the medication drawer, and I am looking at the integrity of the package. It has been opened. It was opened on 3/20/23, and the initials are Heather Norsby. The medication itself expires in February of 2030, and it is not broken, the top hasn't been tampered with, and the solution is not cloudy, it is clear, which is what it needs to be. And I have a 23 gauge needle that is 1.5 inches long, which is the appropriate needle and gauge for my patient and my medication, and route. And I have a 3 milliliter syringe, and I have my filter, and my integrity of my packages are good. They're not open, they are not ripped, or anything else that's bad. So I'm going to do my second check. So I have Joe Smith. I have Ketorolac 30 milligrams. It is the right dosage, it's the right route, which is IM, it's the right time, as it has not been giving it, and Joseph is in pain, and I have the right calculation. Yeah, okay, so I'm going to put on my gloves. Put my gloves on. I am going to scan Joe's wristband, and I'm going to scan the medication vial. I am going to get my alcohol wipe, and I'm going to cleanse the top for 30 seconds. Okay. I am going to open my syringe and my filter. I'm going to take out my syringe and twist on my filter there. I'm going to draw back to 1 milliliters of solution. Ow! Ooh, that kind of hurt. Okay. To 1 milliliters of air, not solution. I'm going to take off my needle cap. I'm going to place it directly down, maybe, yeah. I'm going to place it upside down. I'm going to inject my air and draw back to 1 milliliters of solution. Air though. Okay, I'm just going to take this out and drop a little bit more air, and then do that, because I have this giant air bubble that I cannot get out. There we go, that's much better. Okay, flip it back upside down. I'm going to open my package. I can show you that I got 1 ml. It's upside down, but that's okay. I can show you again. I'm going to take this out. I'm going to use the scoop method to put the cap back on my needle. I'm going to screw this off, place it in my sharps. I'm going to get my new needle and twist it back on. Whoop, maybe? Yep. Oh, I got my glove stuck, that's fine. Okay, and here is my 1 milliliters of solution. Okay, so I'm going to do my second check. My patient is Joe Smith. My medication is Ketorolac. My dosage is 30 milligrams. It's 30 milligrams, but I'm going to be giving him 1 milliliter of solution because the dosage is The dose conversion is 30 milligrams per 1 milligram of solution. The right route was just intramuscular. I have the right time, as it has not been given yet, and Joe is in pain, which is why he's receiving this medication. I have scanned my patient, Joe Smith. I have scanned my drug, and I have prepared my stuff. Okay, so I'm going to do my third check in the room with Mr. Joe Smith. Maybe if I can get this down. Okay, there we go. Hi, Joe. I'm Danielle. I'm the student nurse that was in here earlier. I have your pain medication here, okay? So, your pain medication, Joe, verifying with his wristband, is ketorolac. I have 30 milligrams in a 1 milligram solution, or 1 milliliter solution, as the conversion is 30 milligrams per 1 ml, so I have 1 milliliter of solution. I have the right dosage. I have the right route, which is in the vasogluteal, and I have the right time. It has not been given yet, and you're in a lot of pain, so we're going to give you this medication. I would monitor his BUN, AST, and ALT studies, but Heather has not put that in the Excel or updated it, so I don't have exact values, but I would make sure that it's right. And some side effects of this medication, Joe, is nausea, vomiting, drowsiness. Report any any changes in vision or any ringing in the ears. Make sure you avoid driving for the next couple hours or any hazardous activity, since it can cause some drowsiness or dizziness. And this medication works by inhibiting the cyclooxygenase enzymes, which blocks the pain receptors and decreases pain. So I am opening my package here, my alcohol wipe. I'm going to place my palm on the chromium process. My thumb is pointing towards the anterior side of the body. I have my finger on, I have my pointing finger on the anterior iliac spine, and I have my middle finger on the iliac crest. I'm going to take my alcohol wipe, and I'm going to scrub in circular motions for 30 seconds. And I'm gonna leave my my swab there. So I got a little pointer. I'm going to get my medication. I'm gonna use one hand to take. I'm gonna use one hand to take off the lid. I'm going to be injecting it at a 90-degree angle, small poke, and I will be administering it slowly. And I will make sure to leave in the medication for 10 seconds after it is all in. I'm going to pull it out. I'm going to use the scoop method to do this. I'm going to apply pressure with my gauze for 10 seconds. There is no bleeding, so I will not be placing a Band-Aid. I'm going to throw my needle in the sharps and take off my gloves. Alright, Joe, you let me know if you have any side effects, and in an hour I'm going to come back and reevaluate your pain. I'm going to cover you up so that you're a bit more comfortable. Your bedside table's in reach, your call light's in reach, no risk for falls, his bed is lowered and locked, He has everything he needs. Joe, is there anything else I can do for you today? All right, I'll let you rest, okay? And I will document my findings.